In this video, I'm going to talk about Medicare Supplement Plans, Medigap. So Medigap is also called Medicare Supplement Plans. So Medicare has various deductibles and coinsurance amounts that roughly equal to only 80% of covered charges. There are 10 standard Medicare Supplement Plan Medigap available. The details of the plan change and the plans are dropped and add new trend emerge. Each year, detailed description of the plans is made available. So basically, for you covered in the Medicare, you have a Medicare Part A, Part B, then Part D. So then you, because they have a deductible coinsurance, so when you have a serious disease, then you need extra care. So those things are not provided by the Medicare. So Medigap can fill those gaps. So especially like you covered on Part A, you have to remember if you if you hospitalized more than 150 days, the everything is out of your pocket. You are not covered. So that's probably Medigap can cover you those things. So retirees may not be turned down for the Medicare supplement policy as long as they apply for the coverage within the 6 months, enroll Medicare after 65 when they retire age 65. The 6 months guarantee issue enroll begins when the individual sign up for Medicare Part B. So basically, when you sign up Medicare Part B, you should sign up the Medigap because they give you 6 months guarantee issue. No matter you have a cancer or you have a any other dying disease, they cannot refuse you. So you are guaranteed to sign up with the Medigap. Then for the company cannot charge it more because of pre-existing conditions. Company may refuse to cover pre-existing conditions for the 6 months after enrollment, but must fully cover the individual after 6 months elapse. Additionally, providers of the Medicare Supplement Plan must deliver the Medicare Supplement Buyer Guide to each buyer. Medicare Supplement Insurance plans do not cover long-term care needs and such as custodian care, adult daycare, care for the with Alzheimer's disease or assisted living. So you can see Medigap does not cover long-term care. So this is a 10 Medicare plan. You can see you only can select one. You can see there's A, B, C, D, F, G, K, L, M, N. So its total is 10. So the chart below shows the basic information about the different benefits that Medicare Supplement Insurance Medicare plan cover for 2021. If a percentage appears, the Medicare plan covers that percentage of the benefit, and you responsible for a rest out of the. So basically, if they cover the 75%, you cover the 25%. Let's see the benefits. So Medicare Part A coinsurance and hospital cost up to additional 365 days after Medicare benefits are used up. So you have to know the Medicare is up to 150 days. So this one will cover up to 365 days. So you can see they fill the gap here. Then the Medicare Part B coinsurance and the copay, you have a copay is 20% in Medicare Part B. So this is covers the coinsurance and the copay. Then the blood the Part A hospice care coinsurance and the co-pay skilled nursing facility care coinsurance. Then Part A deductible. Part A deductible that on $1,448. Part B only $203. So it's not much. So Part A deductible not significant. Part B excess charges. For the foreign travel and emergency, this one can be a good one. So you don't have to do, so C and F no longer available. C and F no longer available. So you can do, D is not too bad. D is almost covered everything. So D can be a good choice. So yeah, also you have to see your states. If some, your state's places you live, you are covered. So here say, what else should you know about the Medigap? So before you can buy the Medicare Supplement insurance, you must have a Part A and a Part B. So you must have a Part A and a Part B. So you pay the private insurance company a monthly premium for the Medigap, in addition to the monthly Part B premium you pay to the Medicare. Also, if you buy Medigap and separate Medicare drug plans from the same company, you may need to make two separate premium payments. Contact company to find out how you pay the premium. So basically, when you know Medigap, you have a Part A is no premium for most people. Then Part B, you have a $148 per month for currently in 2021. So then you have to get drug Part D. So maybe another $30-40 per month. So that will give you like a $200 per month just with Part A, Part B, Part D. Then you get Medigap. I'm not sure how much is the Medigap. I will show you example later. Maybe I don't know, $200 per month. Then you were looking at the $400 per month. So they say is the premiums really vary dramatically. So you have to to talk to the providers in order to get the accurate premium. So anyway, a Medicaid policy only covers one person. Spouse must buy separate coverage. So you can see spouse is not covered on your Medigap. You cannot have a drug coverage in both Medicare and your Medicare drug plan. So you only get one drug coverage. It's important to compare the Medicare policy since the coverage can vary between the policy for exactly the same coverage. May go up as you get older than states limit Medicare premium cost. So the premium, I will show you later, they have a different way to pricing the premium. So when you get older, the premium may get more expensive. So in some states, you may be able to buy another type of the Medicare policy called the Medicare Select. So Medicare Select is a type of the Medicare policy. So in some states, they require to use the hospitals, and in some cases, doctors within the network to be eligible for insurance benefit except the emergency. If you buy the Medicare Select, you have the rights to change your mind within 12 months, switch to standard Medicare. So just keep in mind that there's something called Medicare Select. So check in your states if it's available. So Medigap plans sold to people who are new to Medicare on or after January 1st, 2020 aren't allowed to cover the Part B deductible. So because of the Part C, Part F are no longer available to people new to Medicare and the January 1st, 2020, after the January. So basically, they say C and F no longer available. So when can you buy Medigap? Buy a policy when you are first eligible. The best time to buy the Medicare policy during your 6 months Medicare open enrollment. You generally will get better price and more choice among the policies. During that time, you can buy the Medicare policy sold in your states. Even if you have a health problem, this period automatically starts the first month you have the Medicare Part B insurance. So you are 65 or older. It cannot be changed or repeated. After this enrollment period, you may not be able to buy the Medicare policy. If you are able to buy one, it may cost you due to the past present health problem. So this is very important. So once you enroll in Part B, so you should shop for the Medigap, because within 6 months you are guaranteed enroll. So it's very, very important. They're saying here is cheaper, have more option. So if you missed this window, you probably will gonna cost you more. So that's very important to know. So during the open enrollment, Medicare insurance companies are generally allowed to use the Medicare underwriting to decide whether to accept your application, how much to charge you for the Medicare policy. However, even if you have a health problem during your Medicare open enrollment period, you can buy any policy the company sells. The same price as people with a good health. You can see you have a lower premium. They cannot charge you higher if you have a pre-existing condition. So here say if you are 65 and older, your Medicare open enrollment period begins when you enroll in Part B. You cannot change and repeat. In most cases, it makes sense that enroll in Part B when you are first eligible, because you might otherwise have to pay a penalty. So here just say when you older than 65, so then you anyway, so you start your Part B enrollment. So you should shop for your Medicare, so that you have, since you're gonna get a one-time shot, so you can choose one, then you cannot change it later. So just make sure you know that. So cost of the Medicare policies. Each insurance company decides how it will set the price or the premium for its Medicare policy. So it is important to ask how the insurance company prices its policy. So the way they set the policy affects how much you're going to pay now and in the future. Medicare policy can be priced in 3 ways. They say they have 3 types of pricing way. One is community rated, called the no age rate. So it's one rate for everyone. Issued age rated, also say entering age rated, attained age rated. So here says community rated, which is no age rated. So how the price, generally the same monthly premium is charged to everyone who is in the Medicare policy, regardless of age. What does the policy may mean for you? Your premium isn't based on your age. Premium may go up because of the inflation and other factors, but not because of your age. So example here say Mr. Smith is 65. He buys a Medigap policy and pays $165 per month premium. So Mr. Person, Peter, 72, she buys the same policy. So she also pays $165 monthly premium, because this is Medicare policy, everyone pays the same, so it's not based on the age. So it doesn't matter how old you are, you pay the same premium. But other pricing way, they may based on your age. So just be careful what you're looking for.